It is the River City Hardball Podcast. I'm your host, Andrew Gibson. Always a pleasure to welcome in my friend Jacob Evanich from Optimized Physical Therapy and Sports Performance. How are we doing tonight, man? October is so much of sports. It's football, it's baseball, it's basketball starting up, hockey started. Do you find pleasure in watching all this stuff?
Dude, me and my college roommate, every Saturday when we'd walk out of our room, all we would say was we'd look at each other, get a grin on our face, and say, "Love this time of year. It's the best time of year." So every year we end up saying that in October. We just love it. I mean, it's awesome having all these sports finally, especially after the summer where really all you have is the regular season for baseball, and finally everything's really going. So yeah, love it. I know you do too.
Oh yeah, man! I got my App State shirt on. The Braves are right now, as we speak, playing in a NLCS game tonight, and man, I just love it. It's so much fun during the month of October. I think it's the best sports month of the year. There's others that have an argument, March, April, stuff like that, but I think October, with all the sports going together at once, is by far to me the best one. Tonight we're going to talk about ankle sprains, and in specific terms, I've heard a lot of us have heard a lot about high ankle sprains, but I don't feel like you hear too much about low ankle sprains. What's the difference between the two?
So I feel like low ankle sprain just kind of fly under the radar because I know me growing up playing basketball all the time, you just twist your ankle and just rub it off and keep going. So I feel like it just doesn't get the major headlines or anything because when you do get a high ankle sprain, it is a little bit more severe and tougher to come back from. So the low ankle sprains are they get the ligaments that are right in that ankle joint itself, both either on the inside or the outside of it. So you can have a lateral ankle sprain, which is what we usually see, which is when your ankle rolls in and it ends up hurting the ligaments. And we'll talk about it more in a little bit, but could involve some of the bone or also the tendons and muscles that get stretched out. And then you can also have your foot, which isn't as common, but you can have the foot kind of go out, and then that ends up getting what they call the deltoid ligament complex. And then the high ankle sprains, you have your tibia and your fibula that kind of come together to make your shin bone or your lower leg, the calf area. And you have some tissue that goes in between those, almost like a ligament that goes in between those two bones to help them stay together. So when you get the high ankle sprains, it actually ends up, it's called the syndasmosis is what it's called. And you end up getting a little bit more of like you're getting your ankle twisted, but there's also a rotation mechanism to it too. And then that ends up causing the syndasmosis between those two bones to stretch and tear a little bit. And then you get a little bit extra movement of the fibula and the tibia together when they're usually supposed to be very taut. So that's a lot harder to come back from.
I feel like we hear a lot about high ankle sprain, and those are pretty tough to come back from, whether it be in baseball, basketball, football. Aren't those the high ankle ones? Those are the tougher ones to come back from?
Yeah, like I feel like one of the best recent cases was LeBron. That's like the perfect example of that rotation mechanism where that a guy came down on his foot and he kind of rolled his ankle, but also there was a really good twist and rotation to it. With that one, it's more common where if somebody can't really put weight on their leg after they end up twisting their ankle, you're thinking maybe that. With the low ankle sprains, you should be able to put weight on that leg immediately. So that's actually one of the things that we look at when somebody does have a lower ankle sprain. Can they put weight on it right away? If they can't, we're thinking that there might be a little bit more going on. Specifically with the bones. So we have certain rules to try to rule out a fracture. So if you twist, you can't put weight on it, we're thinking maybe we need to refer to get an x-ray. If the two, we call it your medial and lateral malleolus, it's those two little like balls on the side of your ankles. If there's tenderness on those, if there's tenderness on the bone that makes up kind of your medial, the arch on the inside of your foot, the bone at the top of that, if that's tender, then we're thinking we need to refer and check for x-rays. And then also there's the bone on the outside of your foot, kind of like your pinky toe. If you rub from the side of your heel and start kind of gradually moving up towards your pinky toe, you'll feel a little bone jut out there on the side. And there's a muscle that attaches there. So if that's tender, we're thinking that maybe when you sprain, that tendon pulled at that bone and could have caused a fracture too. So that's what we kind of look for when we're trying to rule out fractures.
Which one is more common? Is the low ankle sprain the one that's most common?
Yes, that's the most common one. So the lateral ankle sprain, that's the most common. The E version, or the foot kind of going outwards with the deltoid ligament complex, that's not as common. It's usually that inversion mechanism. Just because we don't have the same stabilization in the ankle going that way, there's a lot of motion. So it's not as easy for the ankle to get stopped in that direction by the ligaments and everything else. And the bone, specifically the bone. So the bone comes down further on the inside than it does the outside, which allows that twisting to happen.
You know, when you're talking about trying to, preventative measures and trying to prevent maybe an ankle sprain, what types of training would you do to maybe try to prevent an ankle sprain? Flexibility training, stuff like that?
Yeah, so not as much flexibility, because when you think about it, if the ankle itself is too mobile, then we're at a higher risk of having the twist. But you're right in a way where if you're too stiff and your ankle and foot can't really move to accommodate whatever surface you're on, then you might roll on the side of your ankle just because you can't move in the way that it needs to be. So it just needs to be a happy medium where we need to have enough motion, but you don't want too much motion. If we have too much motion, which happens after we have repeated ankle sprains over and over again, those ligaments can get a little bit long. And then that's what we call, is called chronic ankle instability, where there's just a little bit too much motion at that joint. And to overcome that, you're right, with the therapy, we do what we call like neuromuscular training, where we do a lot of balance. We call like proprioceptive work, where, we're just trying to get that kind of dynamic stability of the ankle, along with, of course, doing exercises to really get the foot, the ankle, and especially the hip and core really strong. If those two things are kind of weak, that ends up throwing everything else off and can put the ankle at risk too.
You led me to my next question as far as the rehab process for an ankle sprain, whether it be low ankle, high ankle. What does that look like?
Yeah, so once again, same kind of thing. So really, after you end up having an injury, we just need to make sure that ankle is as stable as possible. After you have that injury, sometimes there's actually like even a little bit of inhibition of your glute muscles after you have an ankle sprain. So we need to make sure that we're strengthening pretty much everything from the core on down, making sure those hips are really strong, keeping the ankle in a good position, and then making sure that the ankle itself is getting strong again. Because as well, if you have some kind of twist and injury, that proprioception can just get really thrown off in that area. So we're doing a lot of the stability drills. So think like stand on one leg. That would be a really simple one to do initially. Then maybe stand on something that's a little bit on steady, so like foam or something, and then you would add on multiple layers. So say you're standing on the foam, but you have to catch the ball, so you can't really be thinking about it. Your body just automatically needs to be stabilizing that ankle. So that's some of a simple way of kind of showing the progression that we end up making, just to make sure that the body automatically is stabilizing that ankle.
When you're looking at an ankle sprain and you're talking about trying to get back onto the field, I feel like a high ankle sprain is one of those that may not look as bad, but boy, that thing can be nagging, can it?
Oh yeah, big time. So just doesn't heal as well. Lately, Tua was one of the major names who ended up having a high ankle sprain, where immediately they just ended up going in and basically doing a surgery where they end up stabilizing those bones together again. That injury, it just really does take a lot longer time to completely come back from and completely heal up. And athletes will have a lot more pain with that one for a lot longer period of time. And like we were saying, one of the big things is you can't even put weight on the leg. So it's hard to initially kind of rehab and all that kind of thing.
Yeah. How does that work? If you can't put an initial weight on the leg and the ankle, is there just like a timeline where you can't do any activity?
We have to control our activity. So it delays how we might not be able to come back as quickly because we can't push things as quickly with the rehab process. But maybe we're doing things where we're sitting down and doing exercises sitting down without having the weight actually on the foot. So there are different exercises we can do. They're pretty simple, but they'll be effective, and at least getting those muscles to start strengthening around the ankle. And then as well, just finding other ways to, like we were talking about, core, hip, even knee, thigh, all that, training all those muscles too, just in a way without standing on it.
We do see ankle sprains in baseball, certainly, but it's an injury that happens in every sport, right?
Oh yeah, 100%. Yeah, baseball, sliding into the base, it can happen a lot where a foot gets caught. You don't really see it too much when a play's going on in the field, sprinting after a ball or anything. But sometimes you do see it, and I even know why am I blanking on his name? For Boston, is it Martinez?
Yeah, JD Martinez.
JD Martinez, yeah, I can't believe I forgot that name. He ended up hurting himself he was running out to the outfield, and he ended up stepping on the base and twisting his ankle. So sometimes it happens. He just does that. It's just kind of good luck thing to step on that base, but at that time he ended up rolling his ankle. So sometimes it happens playing, sometimes it happens with our baseball rituals too.
Yeah, no question about it. A few more minutes here with Dr. Jacob Evanich from Optimize Physical Therapy and Sports Performance. You've been promoting the podcast and sending it out to a lot of people that we've done a lot of different episodes. Tell people where they can find it.
Yeah, absolutely. So first of all, we have an email list, so that's an easy way to get on that list and then send it out. If you do want it off of our website, you can put in your information, optimizeptsport.com, and you can just write a little note saying you want to be getting the podcast, and then we'll make sure to send it out to you. Also, anybody can reach out to us via our Facebook page or Instagram, just direct message. So all those ways are good ways to get in contact with us. But yeah, I mean, we've really, we talk about this a lot behind the scenes on what we kind of want to cover and all that. And it really is a good review if people really want as much information as possible, get a general idea of how these injuries happen, how to really rehab or even prevent them, some of the risk factors to try to stay away from. This podcast is really good for that. So I'm glad you really wanted to do this and that you enjoy doing it, because I think it is a good thing.
Yeah, we have a blast, and we're trying to be, informational for people that are listening and watching as well on YouTube and on your website. It's a great outlet for people that want to find out more information about things like this. And, again, we're talking about injuries that are happening currently. We're not talking about, injuries that happened years ago. Sometimes we do, but we're talking about current examples and things that we see. In the last few moments here with you, I saw Justin Turner from the Dodgers had to be carried off the field last night with a hamstring pull. Now, they did come out and say it was a grade 2. Have you ever been in a situation where on a hamstring, a guy's had to be carried off the field?
Not that I can remember it being that bad. Usually it can limp off or what have you. When you said that he had to get carried off, because I didn't actually see that game, I just saw he was out for the remainder of the season with a hamstring, so I didn't realize how severe it ended up looking. But even with the grade 2, you can have a good amount of bruising and everything that ends up happening. So it can be a little bit of a higher grade 2. And, what you're kind of thinking of is somebody drops and they can't really get up with a hamstring injury. You're thinking maybe, we had talked about it before, like the tendon ended up pulling off some of the bone, or there was a complete rupture of it. But luckily, obviously, it didn't have that, but it must have been a pretty significant grade 2 injury.
Yeah, there's a lot of injuries in this NLCS for sure. Guys that are on the shelf, Dustin May, Clayton Kershaw, Ronald Acuna. There's so many stars. Even though both lineups for the Braves and Dodgers are star-studded, there's still a lot of stars that are still on the shelf as well in this series.
Yeah.
A final thing for you tonight, tell people again what you're doing at DBAT, where they can find you, how they can get over there for you.
Yeah, so at DBAT, we're providing physical therapy, sports performance, and speed and agility training. So just depending on what anybody's looking for. So if they're having a little bit of pain, we focus a little bit more on the physical therapy side of things. If we are looking more for specifically speed or typically along with that, some strength training. We had talked about that in the previous podcast, so go listen to that one. But it'll explain why strength is so important with developing your speed. And but people can find us either at the website, like I mentioned before, optimizeptsport.com, at our Instagram page, Optimize Physical Therapy and Sports Performance. You can Google us as well. We'll pop up, and Facebook as well, of course. And then you can always just drop by DBATs and pop your head in and more than happy to talk to anybody about what we do.
Yeah, and you guys do it all year round. It's not just baseball season. It's all year round over there at DBAT, so definitely check them out. As he said, Optimize Physical Therapy, Sports Performance. Check him out on all the outlets that he did mention there, Facebook, Instagram. Everything that he said there is fair game to go check out for sure. Dr. Jacob Evanich from Optimize Physical Therapy and Sports Performance. It's always a great conversation, man. I enjoy these every single week. Hope everybody watching and listening does as well. And we'll catch you next week.
Sounds good, Gibby. Thank you.